something that affects probably every single one of us in this room, which is the topic of dentistry. Everybody at some point or another, I am sure, has had their teeth fixed or fiddled with or examined in some way. And yet there are some issues with the way that we do this in the mainstream. Now, Dr. Graeme Munro-Hall is somebody who is a dentist and yet questions enormously some of the practices which have just become accepted as the norm. And when somebody lent us a copy of Toxic Dentistry Exposed, which is the book that they have written, we were struck very much by that this was something that we should be discussing. So for the first time, we're going to have a presentation about dentistry and looking at some of the dangers and some of the ways that we can avoid some of the worst risks of all the interesting chemicals that we wind up with in our mouths and beyond. So please give a big round of applause for Graeme. Thank you very much.
Well, I hope you can all hear me. Thank you very much for the invitation. This talk is just a little taster. I normally give talks for either half a day or a full day or even 2 days. So in the 50 minutes, we're just going to be touching on topics and moving on, touching and moving on. You'll see various email addresses come up because I've compiled this talk from various other talks I've done over the years. And feel free to contact me on those email addresses. As was said, my wife and I, who isn't here today, she's dog sitting, we wrote this book. And since then, certain things have happened. So I'll tell you about me. I've been a dentist now since 1971, a long time. Probably before a lot here were even born. I've been in general practice all this time. I've been mercury-free for 26 years and metal and infection-free for 15 years. I'm president for my sins of the International Academy of Oral Medicine and Toxicology in Europe. This is a group of doctors, dentists, and scientists who have dedicated their time, energy, and money to the pursuit of scientific truth and have it applied to people's health. I'm also in charge of the transition and training for the World Alliance for Mercury-Free Dentistry, where we actually go to countries in transition who want to transition away from mercury-free dentistry, and we tell them how to do it, what they need to do. We apply training courses and things. With LIllian, who isn't here today, we developed a detoxification protocol called VTOX, where we use intravenous vitamin C, glutathione, and all sorts of other things. I'm not really going to go into that aspect of it a little bit. We might touch on it towards the end if there's time, which is unlikely. But after 20 years of harming people, I wanted to spend the next 20 years not harming people, and not only just not harming people, but actually getting people well from the harm that modern dentistry does. We run a mercury-free holistic practice. We're in Bedford, and it's nice to see familiar faces here in the audience. What I'm going to tell you today will alarm, shock, and upset you, and I'm sorry about that. But it's the truth, and you have to live your truth, no matter what. The authorities aren't too keen on what we're about to say and what we're about to show you for obvious reasons. And we've run into constant problems with them. I've already had one prosecution for gross professional misconduct behind me. I have another hearing coming up in January, and they're preparing a hearing beyond that. So if they don't get me on one, they'll keep on going, probably until it happens. I'm a heretic. And you know what happens to heretics? They're already collecting the wood for the fire. It really all started when we wrote the book, you see, because it can't attack us for the book, because the book only describes the scientific evidence and the truth that's out there. And it's very difficult to attack scientific method. That particular slide I'm showing you came from the Stockholm conference with the United Nations, because I'm happy to say that even though the doctors and the dentists are happily in pursuit of putting mercury into your bodies, the United Nations is in fact developing a treaty to take it out. And I have been part of that negotiations. Sandra Goodman, the editor of Positive Health, called the book highly subversive, specialist informative, and quite possibly life-saving book, which is exactly what we tried to make it out to be. What I'm going to do today is to show how dentistry is really behind most of the major chronic diseases that you see out there. We've developed a concept which some of you might find quite startling as we go along, but I'll show you how we do it. It's sort of a beginning. We can go to Alzheimer's all the way through, and I'll end up with a dental connection of cancer, and I'll also end up on a series of hope. There's hope at the end of the tunnel. A lot of these modern chronic diseases are, in fact, modern. Alzheimer's is now celebrating its 100th birthday. It didn't exist 100 years ago. Multiple sclerosis, first reported case, 1856. It's also a modern disease. Autism, unknown before the Second War. Now in some parts of California, 1 in 30 male children have it. And a lot of this is due to the environmental pollutions, and a lot of the environmental pollutions are in fact dental, because we, as dentists, are inserting highly neurotoxic elements freely given off 2 inches from your brain. So you don't have to be a rocket scientist to work out there is a subset of the population which will be injured by that. The group I'm in has actually done a lot of scientific work where we can actually measure what percentage of the population will be damaged by the fillings given to them by the dentist. And I can tell you we have scientific evidence that 1/3 of the population will have a health event directly attributable to their dental treatment. And that is a very, very conservative estimate, and it's also entirely preventable. You can see why we're liked by the authorities. Modern chronic diseases. Let's talk about, say, Alzheimer's, multiple sclerosis, Parkinson's, explosion of autoimmune diseases, allergies, chronic fatigues, inflammation, circulatory, heart disease, cancer. Cancer's an old one. Mental diseases. World Health Organization say there is an explosion, I quote their words, an explosion of depression, and it goes over first world, you're not allowed to say third world anymore, and developing countries. And our concept is, so if you may have Alzheimer's, you may have schizophrenia, or what, this is fine. But we say they are simply a label for symptoms that you have. The disease per se is a nonsense, it doesn't exist. You have the symptoms of Alzheimer's, you have the symptoms of Parkinson's. What they are really saying is that, what we are saying is that you have been polluted, and according to your own particular individual genetic makeup, that toxin reacting on your genetics produces these symptoms, and the symptoms are handily labeled as disease. How we came to this startling conclusion was, when we detoxed people, and we have a quite radical detox program, all sorts of things got better. Quite amazing, the speed with which they got better. The healing capacity of people was enormous. And this brought us onto the idea that modern medicine and dentistry addresses symptoms, and symptoms only. It does not address the cause of the disease. This is a very important slide for the concept I want to get out. No money is ever made from curing a disease. Why has there never been a cure for cancer? Because the money is made in treating cancer, not curing it. Come to me as a dentist, you have decay in a tooth. What do? I cut out the decay and I put a filling in. I am not curing anything. All I am doing is repairing the symptom of. Your problem is a low pH diet, etc., a lot of the other things. As a dentist, we don't address this. All we're addressing is the symptoms of disease. we are more likely to be part of the problem rather than part of the solution when it comes to health. No drug ever cures anything. That's a bold one, isn't it? There isn't a drug out there that cures a single disease. If there is one, I would like to hear about it, because we haven't done yet. The object of drugs is to suppress the symptoms while the body cures itself. Western medicine excels in trauma. If you've been totaled in a motorbike accident, you do not want to be sent to the homeopath. You want to be sent to the orthopedic surgeon. Long-term chronic conditions are what we're facing. Dental toxic loads comes into three: materials, infection, and structure. I'm just going to touch a tiny bit on structure, quite a lot on materials, and quite a lot on infection, because we never see a single case of cancer without an oral infection, ever. This was a wild hypothesis we had 20 years ago, and it has now been taken up, and more people, as you'll see get towards the end, will connect the two together. The reason I put these dates in are these are the dates when the incontrovertible scientific evidence was first presented that dental materials caused disease, 1925. Infection, dental infections causing systemic serious disease, 1915. We're coming up to nearly 100 years, that one. And structure, well, we're only sort of 30 years old. These are the definitive scientific, when the science was out there for people to learn, and we never learned it. At dental school in the 1960s, we never learned this. All this was hidden from us. So our basic premise is the toxic load plus your genetic predisposition will give you a modern chronic disease, or MCD. For a quick example, if I put mercury in a patient A, they may end up with anxiety and depression. For exactly the same treatment on patient B, they could end up with multiple sclerosis or Parkinson's. Same toxic load, different set of symptoms. The only difference is the genetic code of the patient. This went down well at the United Nations, I must say, when I was giving a talk. I was allowed to present for 2 minutes. And so I was quickly going through these slides, and the World Federation of Dentists were behind me, and of course they're solid pro-amalgam, because they're sponsored by the amalgam industry. And he was given 20 minutes to speak, and I'm happy to say at the end of 2.5 minutes when I finished, he walked out of the room. The scientific case against amalgam is clear and overwhelming. Those who say otherwise are lying to us or incompetent. Now, that's a very bold statement, because the American Dental Association is in support of amalgam. The British Dental Association is in support of amalgam. Amalgam is the most commonly used filling material. It's 50% mercury. When I was a student, I was told the mercury didn't come off. They were lying. It was proved it came off in the 1920s all the way through. I'll show you in a little bit the massive amounts that comes off. If we have time, we can go into where it goes and what it does. The knowledge of this has been out there for years and been deliberately hidden. It's been hidden from the general dentist as well. So it all comes down to the question, why? Why, when something basic and affects everybody like this, why is it being hidden? Dentists who use amalgam compared to mercury-free dentists. This is a good one. Again, all this scientific, verifiable facts, and a lot of the research we as a group have done ourselves. Decreased fertility, especially in dental assistants. Lowered IQ. 15 years working with amalgam. As a dentist, you've lowered your IQ 7 points. Maybe that's why they want to continue to use it. Lower hand and eye coordination. Higher rates of anxiety, depression. 40% higher suicide rates. There's been 4 separate studies on suicides of dentists. In our own practice, we went through and just did a survey for neurological symptoms. In our practice, we had, as I say, 15% had no improvement. But all the neurological, it could be neurasia, it can be what's called essential tremor, it can be Parkinson's, it can be Alzheimer's, it can be dementia, it can be anxiety, it can be depression. We had an 80% success rate within 8 months, and all we did was take out the fillings properly. That's all we did. Make them change the diet, alter the pH, flooded them with so much vitamin C, you think you're floating a battleship. We give intravenous vitamin C at quantities that's fairly high. The highest amount of vitamin C I've ever given anyone in one day is 300 grams. That was to a Gulf War veteran who told me, originally we started off with him 150 in the morning, and he said, I need another one. So we gave him another one, and we did that for 3 days on the run, and he walked out and he was finished after that. We do use enormous amount. Vitamin C itself I could talk about for a long time, because that's a forgotten technology. The reason nobody uses it is because there's no patent on it. No one's going to make money out of vitamin C. Vitamin C is a beautiful detoxifier, and it's a totally safe detoxifier. It was a detoxifier of choice for drug overdose in the early 1950s, but fell out of fashion after that. This is a typical silver amalgam filling. This one is obviously being patched up. What I'm really pointing out to you is a nice crack down the side. This shows one of the essential problems with amalgam. As the mercury leaches off the filling corrodes. It, in effect, rusts. As in all metal that rusts, it expands. It's stuck within the tooth, it expands, it cracks the tooth. Every single tooth that's had an amalgam filling in is cracked. Every single one. And when you take out the amalgam filling, this is the sort of thing you commonly see underneath. The whole of that cusp on the inside is fractured and could fall away. So we have to come down to a question, what are the long-term chances of that tooth surviving, of the nerve being intact? That is a complete pathway for bacteria, other toxins, not just metals, to go down into the bone. Very common, I would say the vast majority of us here come down and suddenly a tooth has broken off. So you go and see the dentist. Why is it broken off? Did some angel come down in the night and say, right, we'll crack his tooth off? What's happened is the amalgam has expanded and part of the tooth's fallen away. So you go from a small amalgam to a large amalgam to putting a crown or cap on the tooth. Financially, it makes a lot of sense. Another typical tooth, cracked, taken out of amalgam. These teeth are symptom-free. People come in for me just to have the amalgam taken out. So this is when we've taken the amalgam out, and that's what we see. What are the chances of chronic infection setting up under a tooth like that? The green picture is very interesting. What we did, we got a tooth that was 22 years old, or had a 22-year-old filling inside. And we got an India rubber, and we rubbed it for 10 seconds on top of this film, and on top of the filling, and then we put it behind a phosphor screen. A phosphor screen is what they use in the mining industry so they can actually see mercury vapor, because under certain conditions down there, they need to be able to spot it. And what you can see that comes off looking like smoke is 100% mercury vapor. As that mercury vapor comes off, and every time you brush your teeth, it comes off. Every time you have a hot cup of tea, it comes off. Every time it's stimulated, that mercury vapor comes off. It's coming off all the time anyway. If you have a crown, a denture, or an implant made of a different metal, you will have corrosion, and the mercury comes off at a 10 times higher rate than this. The mercury comes off. Within 20 seconds of it being breathed in, it's lodged. Most of it goes to the brain, then some to the heart, the kidneys, and the gut. All this mercury work has been funded by the IAOMT as a group. We've all put money out of our own pockets in and paid the universities to do the research. It hasn't come from sort of the Medical Research Council or the dental schools. They will not research into this because they don't want to know what the answers are for this work. They actually estimated, this is brilliant, the American Dental Association estimated that 0.03 micrograms of mercury per day from one amalgam filling. Well, it's easy enough to measure it, so we actually did. So we measured it, and we found out it's up to 100 times more than that. That's one filling. So one filling could put you at close to the UK limit for mercury exposure in the workplace. And that's for an 8-hour day. You're exposed to it 24 hours a day. The WHO reported that amalgam was the greatest source of human exposure to mercury. Two inches from your brain, the Alzheimer's connection. Again, part of the group, supported this study by Mutter, a German scientist and doctor, who's been interested in Alzheimer's and stumbled across mercury. And he has found, through a whole series of experimental and statistical data, a link between mercury and Alzheimer's. Not only that, he has found a link between mercury from amalgam and Alzheimer's. But still, you'd think something like that might actually make the news, wouldn't you? Is it necessary to ban amalgam? Again, we did a study. We found 1/3 of the US population is at risk from their mercury fillings, at a conservative estimate. Presented to the FDA last December. Latest news, the Parliamentary Assembly of the Council of Europe, which is all the nations in Europe, adopted a resolution urging all its 47 member countries to start restricting or prohibiting the use of amalgam as dental fillings on human health and environmental grounds. So there is a groundswell beginning to happen. The world scientific expert, Lars Freiberg from Sweden, in testimony to the FDA, now the reason I put this up is I want you to read the date at the bottom. That's the 15th of March, 1991, 20 years ago. We consider that dental amalgam from the strictly toxicological point of view is an unsuitable filling material. This is the world expert on mercury, right? The world expert. It is in our opinion that in the future steps should be taken as far as possible to use other materials other than amalgam. Now, as part of this UN negotiations, I went to Stockholm last year, where the Minister of the Environment is head of their Green Party, and he's very much anti-amalgam. So he asked their chemical agency to research into it, because normally they ask the dentist, go to the dentist, is mercury harmful? And they come back and say, no, we've used it for years. No, nothing. So being a smart guy, he went to the chemical agency, who are independent scientists, and said, do we have to use it? And is it a problem? And they said the alternatives are available, effective, and affordable. The day he had that on his desk is the day they banned mercury in amalgam in Sweden. It's banned in Norway. It's banned in Denmark. The supporters of amalgam are the World Federation of Dentists, the FDI. They're contractually bound to support amalgam because they get money from the amalgam producers, and part of their contract is they have to promote and support all the products done by their corporate sponsors. They're also sponsored by the Mars Confectionery Corporation, too. The American Dental Association holds patents on dental amalgam. The BDA, the British Dental Association, just follow the Americans without question. The IADR, which is the International Association of Dental Research, when I put not on my watch, the last chairman, Harold Lowe, was in court giving evidence against an anti-mercury dentist trying to get him to lose his license. He retired the week later and came out with a statement that no one should use mercury fillings. 1 week later. So we met and I challenged him on this, and he said, oh, well, that's what I had to say in my position there, but it's not my personal position. I don't believe it. But he was actually in court giving evidence. Oh. The FDA, the Food and Drugs Administration, well, they're just bought and paid for by the dental industry. Over the years, we've managed to slowly wheedle them back. First of all, it's perfectly all right there's a subset of the population it could cause harm, and then you should be careful on using it on pregnant women and on then children under 6. And then with this new administration, the lady put in charge of the dental section of the FDA, who happened to be the ex-CEO of the largest dental manufacturer and supply house in America, immediately went back and said, no, amalgam's safe, and took off all restrictions to it. The day she did that, the stock in her company went up, and she also holds stock options within the company. The United Nations Environment Programme are going to ban all mercury products. These are the meetings. I've been to Stockholm and Tokyo, and I'm off to Nairobi, where it's sort of a David and Goliath. It's myself, an American lawyer called Charlie Brown, and his organization called Toxic Teeth. And we're there fighting against the FDA, the ADA, and all the rest of it, against putting in mercury in the mouth. And so far, David's winning. It's going to be signed in 2013, in operation by 2018. So we're likely to get amalgam banned, not on health grounds, but on environmental grounds, because it seems what the dentists are saying, yes, it's bad everywhere else. In your teeth, 2 inches from your brain, it's perfectly safe, but it's bad in the water supply. Well, of course, this is a total nonsense, and once you actually get onto a public stage and ask them to justify this nonsensical position, they can't do it. The African Union has come out against amalgam. The Arab League has come out against amalgam. This is a nice one. After amalgam has killed the tooth, we go on from materials now to infection. This is what a typical infected tooth looks like. The tooth has died and we've taken it out. What you see is the lump of bacteria, solid bacteria, all the way around the roots of the teeth. These bacteria emit toxins. These toxins go into the bloodstream. What these toxins do to you depends on your genetic predisposition. Now, it can be that you are genetically strong enough that the toxins don't show any overt signs, and you're okay. For my family, the first sign will be sudden death through a heart attack. That will be the first sign. Other people might have cancer. Other people might have a neurological component. Some people might have chronic fatigue. Some people might never happen at all. There is no test that we can say is you're all right with it or you're not. We cannot measure your individual response to the toxins. How do we know toxins are being emitted? Well, one of the group, Professor Boyd Haley, invented this. This is an analyzer and actually detects the levels of toxin around teeth. You just stick a probe by the side of the teeth. 4 minutes later, you get a readout because it reads the toxins produced by the bacteria, the actual level of them. As far as I'm aware, I've got the only one in the country. Root fillings. You've had toothache. Dentist says, we can save the teeth. It's a lovely word, that. We can save the teeth. They should put it in brackets, but it'll cost you your life later on. Root fillings, you take the nerve out of a tooth, and what happens? Take the nerve out, and then you fill it. The idiot dentist that did this stuck the root filling material through all 3 roots, out into the bone. A passageway for bacteria. They say the tooth is now sterile. No root-treated tooth is sterile. They're always infected. They always have chronic infection, and nobody knows what that chronic infection is doing to you. Another one from my rogues gallery. Small tooth, taken out. This is another cancer patient. Solid bacteria, tooth had been dead years. The bacteria had even eaten away into the root and into the bone. All that is just a solid mass. This is after a root-treated tooth that the previous dentist had said was successfully treated. So conventionally, a tooth that looks like that is regarded as a success. One little case of structure now. This is where it looks complicated, but it's not. As lay people, you will understand this better than a dental audience. This is a case of orthodontics, a child who had a brace, and the teeth been taken out here and here. And now the teeth are straightened. So they go to the dentist and says, we'll take out teeth to make room. Okay? This struck me as absurd when years ago I was visiting Rome and I saw all the skulls they'd lined up from the Roman times. There wasn't a single case of overcrowding. either in the aristocracy or the slaves. Nice round arches. And you read the textbook and it says, evolution has made us, over the years, our jaws go smaller. Evolution works in 2,000 years? Hello? That's news. So something obviously has happened. Why are our jaws smaller now than they were? So the dental idea is, in fact, we'll take out the teeth to make the jaws even more smaller. So when you've done this taking out, of course, what's going to happen? These teeth tilt over. The teeth tilt over. Which means the angle here is now steeper. The angle is steep. So the angle there no longer corresponds to the angle here. Do you see the difference in the jaw joints here? See the difference? When that patient pushes forward, this jaw joint dislocates and goes out, and that one actually gets pushed back. That is courtesy of the dentist taking out teeth at the age of 13. That leads on to the sinuses, cranial sinuses, being shut. No movement in the cranial bones. No lymph drainage going back. It leads on to muscular pain and aches, increased allergies. The whole list of things come back from a simple act of just taking out teeth, when again there was no need for it, because what you need to do is not make the jaws smaller to make them nice and straight, but to expand them to make them nice and straight. Now, I'm ashamed to say it was an anthropologist, a German anthropologist called Bimmler, who taught the dentist to do that in the late 1940s. Again, it's not exactly rocket science. So the sheer fact that the dentist, with all the best of intentions, took out these teeth, he has laid the seeds for chronic health problems throughout the rest of that life of that patient. Implants. Oh, I bet there's some in the audience with implants. Implants are the devil's tool. I did my first implant in 1973, and I did my last one in the early 1990s. That's when I learnt better. Implants are the highest profit item in dentistry today. This was from a Swedish lady who came in. The two marked with an X to what her oral surgeon said could be causing her problems. The rest were, quote, okay. She came to see us because she said she felt so ill she thought she would be dead within 8 to 9 months at the end of the year. She was on her own admission on last legs. What we had to do on this poor lady was to take out all the implants. So we took out all the implants, we took out all the metal, and we went through the full detoxification program. She had implants because she didn't want to wear dentures. But eventually we had to tell her the choice. What do you want to do? Do you want to be healthy or do you want to look good in your coffin? Because I'm afraid that's the choice you're going to have to make. Well, there's no point in sugarcoating the pill. If the truth's the truth, you might as well say it. So we did all this, and then we got the 4 implants that the surgeon said were the healthiest, and we sent them off for analysis to see what toxins they would come back at. And they came back, they inhibited 90% of her enzyme systems in the cells from these. So what dentist had ever done a check to see what these implants do? There are tests out there you can do, things like the ELISA test is one, where you actually test to see what metal will that patient react to. Do the dentists do any of these tests? The theory behind implants is once they're screwed into the bone, then bone grows to them, and it's all perfectly fine, hunky-dory. This is a photograph stolen from a textbook as a perfect, healthy implant. Now then, you see the dark areas around here? And around there? That is called, they call this osseointegration. That is pure infection. Screwed in, stuck into the bone, can't escape. That's what's regarded now as success. Amalgam tattoos. This is another one. Of course, they're not really a tattoo at all, are they? They're just discoloration. And what we've shown here is in fact an infection above the tooth. The infection above the tooth alters the electrical conductivity of the gum, and all the metals in the mouth and the infective lumps congregate towards it, and you get this nice black area. They have to be cut out because they are a seat of metal and a seat of infection. One of the other gadgets we've got is an ultrasound device called the cavitat. When we're looking for infections in the bone, they're hard to find. 80% of all wisdom teeth that have been taken out leave infections behind in adult life, 80%. Conservative estimate, I actually think it's over 90. So how do you measure this? Because you can't see them on x-rays. Well, an aeronautical engineer invented a device called the cavitat, which uses ultrasound, where you put ultrasound through the bone and you get a computer readout, and from the speed the sound goes through the bone, it gives you a 3D picture of what's in there. And what you were seeing up here, if you look to the top where it says 1/8, top, right up there, this is healthy, and that's the space within the bone. Shown to us, hidden. A lady, chronic fatigue, been in and out, had all the conventional treatment, been to every alternative treatment there was, nothing was working on her. Take out a tooth, what do you see? Where the arrows are pointing to is the actual holes in the bone that the bacteria have eaten into. Gets worse. So, the lady, we peel back the gum, and what do we see? Tiny little defect there in the bone, right? Tiny little bit. Doesn't look much, does it? No drills are used in this. I'm scooping out soft muck with a little instrument, a little scrapey instrument. Scrape, scrape, scrape. Don't need to use drills. The bone's soft and it's infected. And it just keeps on going. And going. And that's the hole, in fact, that we ended up with, and we're looking up into her sinus. That is the actual base of the sinus. That's the sinus lining we're looking at there now. The whole of the upper bone had rotted away. I'm happy to say she got better. The latest toy we've got is a thermal camera. Thermography. And what we have found out, this confirmed our suspicions that oral infections are behind a lot of the cancers that we see. If you have a look at this, what we're looking at on this picture here is a hot spot. All a thermal camera does is pick up heat, the difference in heat between hot and cold, nothing else. And yet, hot, hot. And we see it on this side to this side. On this side, a lady already had a mastectomy. We did a thing. I'm indebted to Dr. Wu and Dr. Mostovoy from Canada because they too are working in the same area for these slides. And you can see, same side as the infection, same side as the cancer. This shows, just on a routine scan, an early area that may be something, and we've got it on the same side there. And what we have found out is if that dental infection is dealt with, within 6 months, that goes back to normal. Cancer in his left leg, not just women. This is from Dr. Wu, who's in St. Louis. He sorted out that infection. 18 months later, no cancer in the left leg. These are just a few other ones which we'll rush over. Small, a nice Italian lady, chronic fatigue, carpal tunnel, essential tremor. I love that word, essential tremor. What's essential about it? I'm not sure. It's meant she was 30 years old, but moving like this all the time. Parkinsonism, they call it. Multiple allergies, gut problems. That's what she came with. 1 implant, root-filled teeth, chronic infections. Chronic infections here, under here, and also there, and that. Take those out, 5 months later, symptoms gone. Another one, colon cancer, stage 4, told untreatable. He refused to have anything, chemo, radiation, or surgery. He cleaned up all his lifestyle, everything. He was quite spiritually advanced when the cancer was in an active phase. This is what he was when he came towards us. Again, don't have to be a rocket scientist. Infections up here, infections up there, all this there, another bit up there, and another, you can just see the space behind there. 8 months later, cancer gone, and I'm happy to say he came to see us earlier this year and is now 3 years down the line and it's still away. It's gone. This one, non-Hodgkin's lymphoma. She refused conventional treatment as she was a nursing mother. Remission after 6 months. Obviously a big decay that had to come out. Again, take out this too, take out that, clean up that infection, and take out an impacted wisdom tooth. Routine dental stuff, nothing extraordinary, and yet the non-Hodgkin's lymphoma disappeared. So in conclusion, dental problems lead to severe, dental treatment can lead to severe health problems. The dental authorities know about this. Doctors are mainly ignorant of dentistry. Dental treatment without the proper precautions, because I don't want you to go away thinking, my God, I'm going to have all the amalgams ripped out now. If you have the amalgams taken away incorrectly, it can make a bad situation worse. There are accepted scientific protocols to take it out safely for the patient. You have to find a dentist who works within these protocols. All dental materials have a dark side. There is no good dental filling material. There are just some which are less hazardous than others. All infections from the mouth have to be removed. Antibiotics won't work because the bacteria wrap themselves up in a nice mucilaginous coat and any drugs won't get to them. You may have to choose between looking good in your coffin or losing teeth, but I really don't think that's much of a choice, but the trouble is the dentists aren't giving it to you. All choices must be an informed choice. In other words, how can you choose what is the right treatment for you unless you know the pros and cons of each particular aspect? And no one's telling you that. Do your homework, because at the end of the day, it's your teeth, your responsibility in your life. So you can buy the book on Amazon, which is good. It's probably cheaper than we're selling it for, because they sometimes do special offers on it. Or from the practice. And just spread the message out there to the dentist, to the doctors. Let it go, because this is where the science is leading us. The future is good, because there are groups of us who are clubbing together and out to spread the message, not just through professionals, but out to the public, because dentistry and medicine will only change when you, the consumers of it, demand change. It will not come from elsewhere. If you go to a doctor or a dentist and say, will you do this metal-free for me, and they say no, then tell them you are seeking someone who will. And when enough people leave his door, he'll thinking, well, I might have to change. Because they are a very, very conservative bunch. But the science has already preceded all this by over 100 years in some cases. So it's not a new message, it's just new to the doctors and dentists out there applying this to you. So you have to take the message to them. I'm sorry to give you this brutal message after all this harmony of crop circles and nice music and stuff. As you say, it's probably a first, and I've only just touched on little bits. We could talk for a whole day about neurological disease and how it affects you and why it affects you, and why autism, for instance, and the reversal strategies of all these diseases too, because I haven't met a disease out there which hasn't got a reversal strategy yet, worked out, already published in the science. It's just being ignored. In fact, even this other week, I met a very conventional doctor who published a way of chemotherapy, which is very much against, which was extremely effective, but his way of doing it is very gentle. It was published in 1978 and been ignored ever since. So there's plenty of science out there, if only it's going to be applied. So I hope I've interested you and not bored you too much with this talk, and I wish you well for the rest of the weekend. Thank you.
Graeme Munro-Hall, thank you very much. Thank you. Thank you.